Hi, I'm Dr. David Hargroder, and I want to welcome you to this presentation, Winning the Weight Loss Battle for Life. So, now the question is, okay, I think maybe he's made a good argument that weight loss surgery is probably the way to go. The next question is, are you a candidate? Well, we generally look for patients that have a body mass index over 40. And if you don't know what body mass index is, it's a number that we calculate by taking your height and your weight. We plug it into a little formula, and it gives us a number. If you have a body mass index over 40, the medical literature says you have an increased risk of premature death, and therefore you are a candidate for the surgery, or at least a potential candidate. Now, maybe your BMI is somewhere between 35 and 40. Well, if that's the case, we need to see some medical condition, something like diabetes, high blood pressure, sleep apnea, something that gives us an indication that we're going to benefit you in your health issues by performing this surgery. Remember, we don't do this surgery as cosmetic surgery. We're not doing this surgery to make you look better. We're doing it to improve your health. And therefore, we need to have some health issues to be able to measure to know that we're helping you by doing this surgery. Now, one of the final categories is a body mass index as low as 30 could be considered a candidate if you have uncontrolled diabetes. We know that this surgery is so powerful at improving or even eliminating the need for medications for diabetes and getting your diabetes under good control that someone with a body mass index as low as 31 could be a candidate for this surgery. Now, I want to just sort of run through a few what I call key points. I mentioned one just now. This is not cosmetic surgery. The fact that you might look better or after this surgery, that's just a happy side effect. The reason we're doing this surgery is in order to improve your health and prolong your life. One of the big advantages of the mini gastric bypass procedure, among all of the other procedures that are out there, is the fact that it can be easily reversed or revised should the need occur. Hopefully won't ever have to, but it's always nice to know there's an exit strategy should we need one. Now, time on the operating table is an important thing. This operation usually takes less than an hour, sometimes as short as 30 minutes or so. Average operating time is about 45 minutes, and most patients are in the hospital overnight and back at work within a week or two. Now, let's just review one more time how this surgery, the mini gastric bypass, helps you lose weight. You've got your restrictive component where we've created a small stomach pouch, a long, skinny stomach pouch, so you physically can't eat as much as you used to. There's also the malabsorptive part of the operation where you don't absorb as many calories as you used to because we've bypassed a portion of your small intestine. And there's another way the surgery helps you lose weight. And we kind of theorize this ghrelin hormone that makes you feel hungry after surgery. Not only does it drop, it plummets. And so what you find is that not only can't you eat as much as you used to, you just don't want to eat as much as you used to because you're not as hungry as you used to be. It doesn't mean you won't enjoy food. You can certainly go out to a restaurant, order from a regular menu, enjoy your meal. You'll just be taking a lot of leftovers home. But you just, because of this ghrelin level, you look at food entirely differently. It's just a take it or leave it sort of thing. Now, it does come back eventually, and you do feel hungry eventually. But when you do, it's different than it was before surgery. And you can have a few bites of food, feel totally satisfied, and do not feel deprived at all. It really is one of those things that's hard to wrap your brain around until you've been there. And I say that only after talking to over 1,000 patients that have had it, that all say the same thing. It's something you can't really comprehend until after you've experienced it. Now, one of the things that still amazes me, and I've been doing this for 15 years now, is the amazing effect that this surgery has on various medical conditions. Diabetes, a patient will come into the hospital to have surgery on 100 units of insulin, metformin and whatever other medicines they're on. They get a 45-minute operation, and when they go home the next day, they go home off all of their diabetes medicine. And 9 times out of 10, they never have to go on any of those medicines again. High blood pressure, about 75% of our patients can get rid of all of their high blood pressure medicine after surgery. Sleep apnea, if you wear one of those CPAP masks, usually within 6 months or so, the mask is gone, but not without your doctor's okay. Arthritis in your knees, your back, your hips. You know, you would think, yes, my arthritis will get better after I've lost 100 pounds, but it doesn't really work that way, because the pain in your back and your knees and your hips, you'll notice a difference a day or 2 after surgery. And it's not because you've lost weight, it's because a lot of those hormonal changes going on, we believe, is the cause of that. Cholesterol, triglyceride, your overall lipid panel will get better, as will your overall cardiac function. Your heart will pump better and more efficiently after this surgery. And you'll notice that a week or so after surgery when you're walking up a flight of stairs and realize you didn't have to stop halfway up to catch your breath. So there are many, many benefits to choosing weight loss surgery as an option for your permanent and long-term weight loss. And that is permanency, number 1. Number 2 is the way it makes you feel about yourself is going to change your life. You'll notice new relationships, new opportunities in life. Instead of sitting on the sideline watching life go by, you'll find yourself out there participating. I've got patients that have, considered themselves couch potatoes before surgery that are now running races and competing in Ironman competitions. We've got ladies that have had the surgery that are now enjoying the rides at Silver Dollar City with their grandkids, or we've got one that even has been, parachuted out of an airplane, something she said she never could have done before losing all the weight. So really just going out there and enjoying life. So the life-changing feeling that you're going to have after this surgery is something that is hard to describe on camera. To me, one of the big advantages and the big pluses of having surgery, the permanency and all of these various medical conditions that are going to be eliminated afterwards. Your diabetes, your high blood pressure, your sleep apnea, all of these things, for the most part, gone after weight loss surgery. And so I want to just recommend you to give us a call if you have any questions. We're always available to answer those questions for you, and we really look forward to talking with you and being able to help you in any way we can.